Hey there, and welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat. On today's episode, I am joined by Elise Springer, who is a longtime colleague and friend and just such a knowledgeable person on perinatal mental health and different ways to support people. She has her hands and fingers in a lot of really cool stuff as well. She is a current board member for Postpartum Support International's California chapter and serves as a policy and advocacy chair. She is an emeritus governing council member for maternal mental health now, after serving an 8-year term, in addition to ongoing training faculty for the organization. She served as board member of National Maternal Mental Health Policy and Advocacy Group 2020 Mom Project, and subsequently sat on the organization's clinical advisory panel through 2021. She is a training faculty and emeritus board member for National Perinatal Loss Organization, Return to Zero Hope, and training faculty for paternal perinatal nonprofit Love Dad. Elise is certified in perinatal mental health, an EMDRIA approved therapist and EMDRIA approved consultant, certified in interpersonal therapy by the IPT Institute, and an IPT supervisor in training. She lives and works in the LA area. So as you can tell, she does a lot and she knows a lot. And what I'm constantly impressed by her is that she's always learning, and not only just learning, but learning and finding ways to then help other people learn. It's really amazing, all of the work that she's doing. So in our conversation today, she's going to really deep dive into what IPT is. And it is a validated therapy for the perinatal population. And as you'll hear, it's underutilized. And that is a missed opportunity. I think it would be great if a lot more clinicians were trained in IPT, but also from a client perspective, man, are there some really useful tools and skills in this therapy. So let's get into it and hear from Elise. Welcome, Elise. Thank you so much for being here.
Thanks for having me. I'm so excited to be back.
Yeah, I am too. And you always give such good info and insight and knowledge. And I know, there's a lot of therapists who listen to this podcast, but also people who are just like not aware of what types of therapy are available. So I'm glad you're on here to talk about IPT. Give
Uh,
give an education.
Interpersonal therapy. Yes. And actually, I think if I'm remembering, so this is interpersonal therapy. And I think you and I actually were in a training together.
Hmm.
Uh, but I feel like that would have been back in 2012.
Oh gosh. Is that possible?
Yes, it is. It is. It is. It is possible. It was like 2011 or 2012.
Wow. Yeah. All I remember is that I was on my birthday.
Oh,
I was there on my birthday. We did level A of IPT, interpersonal
mhm.
therapy training.
Yeah. I'm so curious. What do you remember from it?
I remember it being like I didn't know what to expect. But I remember the trainer, Stuart Scott,
That's right.
being just so
Scott Stewart, but
I mean,
yes.
I always mix it up. Scott Stewart.
When that happens, you had to,
Scott
kind of
Stewart.
potentially last names as in your name.
Right. Yeah. So he was amazing. And I remember feeling like, oh, there's parts of this that is already part of what I do. And it feels like it will be easily integrated in, and um really usable tools, like
Mhm.
therapist tools, but that gets so much information from the client, and just super helpful.
Yeah. I asked that question mostly, I mean, number one, I mean, yes, it was a long time ago. And so we won't age ourselves too much, except for you were already established therapists at that point.
Hmm.
But I actually, as part of that training, which was interestingly enough, it was like a pilot program
Hmm.
to kind of see how do you best train therapists? How do therapists best learn? And so some of that cohort from that level 8 training went on to getting supervision live, and
Hmm.
then some were assigned the self study. And
Yeah.
and I think both you and I were both given the self study option, and I think both of us were like, "Uh huh, yep." And I don't know that we pursued any of the subsequent levels at the time. I know I didn't.
No, I knew right away that if given the self-study, self-pacing, self-whatever, that I wouldn't do it. Like I needed the accountability of a meeting and all of that in terms of training. So yeah.
Yeah. And there were only a couple of pieces I remembered after that training, which I'll tell you about it in a little bit. But I think a couple of years into it, I was like, gosh, there's like three things I'm using all the time from IPT, but I feel like there's more. And
Mm.
so I ended up kind of getting in touch with Scott Stewart through the Interpersonal Therapy Institute, the IPT Institute, and pursued training that way.
Nice.
And once I was in a supervision group and kind of going through the subsequent levels, it was a lot easier because, yes, self study, I can do it for my CEUs that I have to get. But when it's coming towards like a certification or really
Yeah.
knowing a consult group is just so helpful.
It
Um,
makes a huge difference.
yeah.
Yeah, absolutely.
So let me tell you a little bit about IPT.
Yeah.
And one of the things that I always find interesting, so IPT stands for interpersonal therapy. And the kind of a precursor or beginning of IPT was really developed in the 60s. And interestingly enough, all the studies that we hear about as therapists and maybe as clients too, that say therapy and medication together are the most efficacious. Now, if you have big feelings about medication or big feelings about therapy, maybe sometimes people silo them, but the most efficacious for treatment of like a mood and anxiety disorder is going to be medication and therapy together. Well, the study that sort of people used to determine that was the case was IPT.
Mm.
But CBT was also present at the time. And I always joke CBT had so much better PR. Like, it,
Totally.
because, you know, IPT is evidence based.
Mhm.
There's a lot of research behind it. It works really well with all the mood and anxiety disorders, works really well with actually even eating disorders, although I'm not trained in eating disorders. And it's really wonderful for perinatal mood and anxiety disorders.
Mhm.
So now you know CBT has an amazing PR team behind it, and IPT never did. And that is why it is like one of these evidence based modalities that you just never heard of, right?
Yeah.
Um,
I
People are
mean,
always,
even getting training in perinatal mental health, you'll hear evidence-based therapy for perinatal mental health is CBT and IPT, but there's far fewer people trained in IPT.
yeah. And hopefully that changes. I mean, some of the
Yes.
work that Scott Stewart and the Institute are doing, and I should disclose at this point that I'm a supervisor in training for the IPT Institute. So I do have a little bit of a buy in here.
Mhm.
Um, but I think trying to do more in the VA system, trying to do more, even in California, we're doing some trainings in Imperial County, and there's some supervisory groups happening there. So, and I know it's much bigger on the East Coast, which I always find interesting.
Mhm.
But I think that's because I think in I would say late 90s, early 2000s, a lot of the groups in like Boston and Rhode Island were using IPT. IPT is very cool, not just because therapists can use it, but so can case managers. And the World Health Organization actually even has protocols for IPT that are used around the world. So
Amazing.
they're pretty well known, well used, but somehow we don't know it and don't
Mhm.
use it.
Mhm. Mhm.
So people are always like, well, how does it actually, right?
Mhm.
And so, part of it is that it really enhances social support. The whole goal of interpersonal therapy is to kind of make sure that you have enough social support, right? Same thing for decreasing stress, interpersonal stress in particular. And as you're talking, you're probably thinking, gosh, as I'm talking, you're probably thinking there are some pieces here already. You can see why it's so good for perinatal mood and anxiety disorders,
Mhm.
right? The other piece of it is like, facilitating emotional processing and improving interpersonal skills. So there's four change agents in interpersonal therapy: enhancing social support, decreasing interpersonal stress, facilitating emotional processing, and improving interpersonal skills. And if you're wondering if I'm reading, I am, because I want to make sure I get it right. Uh, but how it started with me is that there's this big piece of IPT that's taught in level A, and it's the interpersonal inventory.
Mm-hmm. I
And so
love that. Yes.
most people know the inventory, and it is kind of like a bullseye tool. So maybe if you're a therapist, you use this with your clients. If you're a client, maybe you've done this with your therapist. It's basically a little bit of a roadmap of like who is in your life, like who is there with you,
Mm-hmm.
and what role do they play? And
Right.
it's also a little bit of like, what kinds of things, if you were going to change those relationships, how might you change this relationship? If you put someone kind of farther away on that circle, how, but you really wish that they were closer, how do you change that relationship?
Yeah.
So that was the piece that like really stuck with me. And I think it's the piece that people remember the most often.
Mm-hmm.
But there, the other pieces of IPT are really that role playing and communication analysis. Like when we think about ways in which people have interpersonal disputes, or let me make it specific to perinatal.
Mm-hmm.
One of the things I hear often are, if I'm working with cisgender heterosexual women and they're in a partnership with a cisgender heterosexual man, right? So we're kind of talking about conventional relationship. I hear a lot of complaints about ways in which either dad is like not supportive, or
Mm-hmm.
if he is, like with chores and housework and things like that,
Right.
or I'm going to totally take a left turn to Albuquerque here and
Mm-hmm.
say, I'm going to quote Taylor Swift.
Nice.
And I go on a little journey, but stick with me here. So, I, however you feel about Taylor Swift, I actually just happen to have my youngest is 9 right now. So I'm unfortunately like, really, this is happening in my household.
Mm-hmm.
But I saw a little interview with her recently, which was like immediately like, oh gosh, why didn't I say this? And then also I have to keep talking about this. So I'm going to mangle what she said. But she was clearly talking about herself in a relationship and a partner who had done something wrong. I'm not sure what it was, but she was saying, look, here's this like original conflict or upset. And then, she was basically saying, look, and now I'm at a point in my life where women in general, kind of stand up and respond. Then what happens is the focus becomes on the response as opposed to the original kind of like distress or conflict, right?
Mm-hmm. Mm-hmm.
And that really resonated for me, because I think this happens a lot in partnerships with both sides.
Yeah.
But one of the things that I hear quite a lot is that, in sort of more traditional relationships, we know when there's a baby born, sometimes people fall back into these very gendered roles,
Right.
right?
Right.
A parent does really need to, in the first 12 weeks at the very least, be focusing at home and recovery. And usually a partner is maybe, if they don't have leave, because this is the United States and we have not awesome leave policies,
Mm-hmm.
is going back to work pretty quickly. And at least for that moment, being perhaps the primary breadwinner. Again, I'm speaking in generalities. But I think what ends up happening is, if that, in those instances, if dad is then in this position where he's going to start helping with the baby, he might say, well, how do I do this? Well, how do I do that? Well, what bottle is best? Well, how do I warm up the bottle? And a lot of times, it can trigger this like sense of agitation and resentment.
Right.
And mom or birthing parents like, look it up,
Right.
right?
Right.
And a lot of times then I get this, well, I should be able to ask my wife like how to do this. And in that instance, just in that example, it's, you could substitute that with any number of things, like
Mm-hmm.
what should I make for dinner? What should I, when should I schedule the pediatrician appointment, right? What I think is happening there is that dad thinks, oh gosh, here I am trying to be of support and maybe doing something different than my dad did, or my intent is to be of help. And mom is like, okay, but figure it out on your own. I
Right.
can't do everything. I can't carry the full mental load.
Right.
And then they get caught in this confusion.
Mm-hmm.
And I know this is a very long tangent, so bear
No,
with me.
it's
But
relevant. It happens all the time in therapy. It comes up like I had to figure it out on my own. Why can't he?
right.
Hmm.
Yes. And I think what happens in these moments is that dad is not realizing that what he's really saying when he says, well, how do I do this? Is, hey, your time is not as valuable as my time. It is easier to ask you than to spend the energy trying to search out the answer. And what that conveys is we are not equals.
Mm-hmm. Hmm.
And so I know I got here from Taylor Swift, but I was thinking about this a lot as she was saying that because I was like, well, this is something that I see in my practice a lot, right? And then if mom is like, well, figure it out, what's dad's reaction? A lot of times it can be like, well, I don't feel included. I'm just trying to do the right thing. Like it's coming frequently, maybe from a place of anxiety. I
Hmm.
mean, maybe there are partners that are just kind of rude and can I say dicks? Like,
Yeah.
I don't, am I allowed to
Say
say that?
you
Maybe,
can
but
say
I
it.
find that frankly, that's not usually the case. It's here we have poor communication.
Hmm. Right.
So we've got already, when we think about IPT, we usually have three target areas: grief and loss, role transition, and interpersonal disputes.
Which is like all of the perinatal period, like that, the whole transition into parenthood is all of those things.
Yeah,
So much of all of it.
yeah. And again, so for me, just to bring you back to what I was saying before of like what had stuck with me when I first took the training was, oh, well, role play and communication analysis. So even though I led us through like kind of a complicated example, it's one I hear all the time. And I think, how I approach it in IPT is to kind of say, like, well, look, I think what's really happening here, we've got some dispute. And part of it is because our communication is kind of off.
Hmm.
So dad, when you're saying, how do I do this, what's your intent here?
Right.
And mom, when you're saying figure it out, I had to figure it out. What is coming up for you, right? Like,
Hmm.
how would you want to say this?
Right. Right.
And so again, like it's just so helpful because you can do the social support work with an individual when using IPT. So those skills of like, you're analyzing what went wrong in this communication. And then frequently I'll role play with clients like, hey, you know, how would you have preferred him to ask you?
Mm-hmm. Mm-hmm.
Because I'm finding that, well, I don't want him to ask me at all. Okay. Well, how might you say that? Hey, babe, remember we talked about this. I really don't want to be your project manager. I don't want to be the project lead, like to be your equal. So I'm just going to make this your side of the street. And,
Mm-hmm.
that's a much nicer way than saying, like, you know, figure it the F out.
Right. 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 And yeah, it's hard, especially if there's been this like pattern of communication, but let's say beforehand, or if it's even if it's brand new and it's just started, let's say after baby comes home, it's like you're already trying to make this major adjustment and having to relearn how to communicate about stuff. It's gonna be wonky. Um, so like figuring out how to say things, how to communicate your needs is so important.
Yeah. Yeah. And you were saying this before, we were talking about, the focus areas in IPT. It's like grief and loss. And a lot of times when you think about people shifting into becoming a parent, there is some grief and loss about what their new life might be. That's the role
Hmm.
transition piece. But
Hmm.
grief and loss over potentially, what their expectation maybe of their birth and labor was supposed to be,
Hmm.
if there's infertility or perinatal, infant loss, like all of those components
Hmm.
are really supported by IPT. And we're talking about the disputes and the transitions. But I think one of the things I really love about IPT is that one, it's a little bit like, here's what's happening. This isn't pathology. You have some depression. But when you're isolated alone in a home, you're going to be depressed.
Right.
And that emphasis on, well, now I have a sense of who's on your roadmap of social support, and I know maybe you used to be closer with Sally, but she doesn't have a kid anymore, and you do, and you're feeling like you're not close to her. Well, what would you like to be different in that relationship,
Hmm.
and how might you approach sort of articulating that your what you need from her maybe, and what you might offer her maybe that's different, right?
Hmm.
Because when we're
Hmm.
doing the inventory, we like to ask those questions around, well, how do you get support from this person, but also how do you support that person?
Right. Right. Absolutely. I mean, like maintaining, establishing and or maintaining connection, um, so that you don't feel isolated.
Yeah, yeah,
'Cause it's so easy to like fall deeper and deeper into depression when you feel that isolation.
yeah. Hmm. And you know, the other part is we've been talking a lot, and maybe I say we, like, I feel like community, like all the perinatal health orgs, I think have been talking a little bit more about decolonizing mental health,
Hmm.
which, I have to just acknowledge I'm, cisgendered and I'm white. And so I've got a lot of privilege because of those two things. And so for me, trying to sort out what is the best way for me to start moving into collaborative approaches with clients.
Mm.
And that's the other piece that is, I think, integral in IPT, right? Like people usually walk away
Right.
from that level A training and they're like, okay, the inventory and role play and communication analysis. But a big piece of IPT is the collaborative goal setting,
Right. Right.
and not you should do this. If you
Hmm.
have CBT, right? There's an activating event and then there's a belief. And what cognitive distortion is it? And how are you disputing it? And
Hmm.
it's like very mechanical, and it doesn't leave much room for open ended discussions. It's got its use because it really reduces some symptomology for
Right.
some people, but it doesn't fit for all people in all communities.
Right.
And
Right.
IPT focuses much more on social support and enhancing that communication within someone's particular culture. And I think for someone like myself who's coming from a very specific upbringing, having the opportunity to be more collaborative is kind of important.
Right. Right. But so you're like even in the interpersonal inventory, you're learning about the relationship and sort of why it is the way that it is, or what the important parts of that is that you don't have to be coming from a top down perspective like I the therapist and telling you, well, you should be more connected to that person. You're learning the ins and outs of the relationship.
Yeah, the client's the expert on their own life. I'm not
Hmm.
the expert who has all the answers.
Hmm.
And, with the way in which you create goals in interpersonal therapy, it's like, well, knowing that we're focusing on one of these three problem areas, well, where is the sore spot for you? Right. So if you've got some postpartum anxiety and it's showing up as irritability with your partner, okay, so how do we improve your communication with your partner so that you have the opportunity to convey to them, I'm not just trying to be a terrible partner. This is coming from this place of anxiety.
Hmm. Hmm. Yeah, and right, problem solving that and role playing it is really powerful because you could think about it in your head all day, but actually doing the communicating, being able to role play that is really powerful. So you can get what it feels like to communicate that and like kind of work out some of the challenges in the process.
And it's reflective.
Hmm.
So if again, we all agree having a new baby is a role transition. That's just an absolute, right? So
Hmm.
another one of the opportunities that we take is like, well, how is this role transition impacting your social support system,
Hmm. Hmm.
right? How does your emotional response during this time period impact your social support system?
Yeah. Well, those are really important, kind of fundamental questions.
Yeah, like before the baby, I was this kind of person, and now I am this other person. And in the future, I aspire to be this other kind of person. But to really understand me now, you need to know XYZ.
Mm,
And it's like little moments like that that I think are what make it a much more collaborative therapy.
mm,
Because again, the client is the expert. And we say that in therapy too, but there are definitely some modalities. I'm sure if I've been on here before, I probably bashed psychoanalysis, but I don't mean to. I, I think it's really one of the foundational training, but it is it's a very straight up patriarchal finger wagging kind of therapy, which says the therapist is the expert and is going to make these connections for you and knows the answer.
mhm, mhm,
And in IPT, I don't know the answer.
mhm,
You know the answer,
mhm.
but how do I support you in figuring out what that might look like?
Right. Yeah, some much more empowered approach.
Mhm.
I think in some way for the therapist too. I mean, right, it's like there I don't know, for just coming from a therapist perspective on this part, um the sometimes the pressure to feel like you need to know something more than the client does or be the expert in something brings this additional pressure that also leads to having blind spots. And if you can relax into like, I don't know the answer, but we're going to figure it out together, that it's just so much more supportive to the client, but it takes that pressure off of you where you as a therapist are like trying to figure it out or like be the therapist.
Yeah. You can be your more authentic self in IPT. One of the
Hmm.
things that I love is that you've met me and you know I'm a little salty. A little kooky, a
One
little
of the
corny,
things I love.
a little kooky, a little corny, and a little salty, right? Like that's generally. So it's a particular brand, but you can really adapt IPT to your more true self.
Uh-huh.
And a lot of the way in which we work in IPT is by being very straightforward about experiences. So whereas like in some other modalities, the clinician is a blank slate. In IPT, if a client says to me, do you have kids? I say, absolutely. Did you have a kid who was like biting? And I said, yes. And I got this book, hands are, mouths are not for biting,
Mhm,
right? But I can answer the question directly. Or, my kids are much older now. So I can say, well, I remember when,
mhm,
I had kids your age and this was my experience. And I'm hearing that there's some similarities to your experience.
mhm,
And here's how I managed it. Does that sound like a way that might work for you?
mhm,
And, you know, if not, like what might you do different?
mhm. Yeah.
You get to bring more of your true self. I should really mention too, the other thing about IPT is that you're really staying in the now,
Mm,
because really the symptoms are now.
right.
And, if we're going off this theory in IPT that, isolation and distress and conflict with your community exacerbates your symptoms, it
Mhm,
kind of doesn't matter what you did in third grade.
right.
And it doesn't mean that that does not inform the therapist's conceptualization.
Sure.
It means that what we're talking about now is what it's like to be struggling with breastfeeding when everyone in your, uh, you know, family never had that issue, and your cousin who just had a baby is
Mm,
like producing extra milk,
mhm,
right? Like
mhm, mhm.
that's sort of where we're staying.
Right, there doesn't need to be like a necessarily a deep exploration of your childhood in order to help you with what's going on right now.
Yeah. That we can, of course,
Sure.
understand the impact,
Mhm.
but we're really more interested on what are your goals,
Right.
right? Your goals are to, um, you know, really focus on how do I improve my mood.
Mhm.
But when in IPT, we want the goals to be a little bit more concrete and more positive,
Mhm. Mhm.
right? So, I will um, make sure to go for walks, uh, get out of my house with
Mhm.
friends as a way to bolster my mood.
Right. Right.
Like I'm not that's maybe not the most perfect goal, but in terms of articulating it, but again, we want it to focus on the positive, like improve
Mm.
communication,
Right.
right? Or feel closer to my partner,
Mhm.
or um, you know, have connection with others in my community.
Mm. Mhm. Right. That does feel sort of more hopeful and more forward looking. Um,
Installation of hope, right? Which is so key in perinatal mental health.
it
I
really
think
is.
that's a lot of the power that we hold as perinatal mental health clinicians is being able to say, I was there,
Mhm.
but now I'm here, and you
Mhm.
can too.
Yep. Yep.
And, there's such a parallel between, I know even, Postpartum Support International, right? It's like with help, you will be well.
Mhm. Mhm.
And, it's so similar in IPT, which is like that same hopefulness.
Mhm. Yeah, absolutely. And there's, um, I think, too, one of the parts of IPT, speaking about it being kind of more current focused, is that it's not a long term therapy.
Yeah, and I think that's what makes it so interesting. But also, it's not a long term therapy, and you never sort of terminate with your clients. And
Hmm.
for patients or clients listening to this, they're like, terminate. What's that word? But
Hmm.
it's sort of like the professional term that we use to close out a case. So an IPT, an average course of IPT, is about 12 sessions. And that can be really lovely because you're really focused. It's a focused treatment.
Hmm.
Whereas some of other therapies can be more meandering, but it doesn't mean the end of the relationship. So, in a clinic setting, it might be more 12. And when I've used it in clinic setting, sure, I just do the 12. And then in my private practice, I can use it in conjunction with other therapies. It just pairs so nicely.
Hmm.
I do a lot of EMDR, and so I'll pair IPT with EMDR. I know I bashed CBT, but I will also pair IPT with CBT. But I will see clients for sort of 12 sessions, and then maybe we move to biweekly or every other week. Maybe then we move to monthly. Maybe then we move to every 6 months. And sometimes what will happen, and what's so lovely about it in private practice, is that maybe I've been seeing a client doing like one check in every 3 months, every 6 months. But then a new kind of concern comes up,
Hmm.
or a new conflict with somebody in their life. And then, we kind of go back and start it again. And I love clients like that because, we kind of already have a bit of a roadmap,
Hmm.
right?
Hmm.
So it's a really nice opportunity to focus on the strengths that clients have. Again, in addition to being collaborative, IPT is very strengths based.
Right.
So if someone comes back in and maybe I saw them 6 months ago, but something new has come up, I have their old inventory and I
Mm.
say, well, let me see this. And they're like, oh my gosh, I can't believe that Sally was like all the way out there on the outer circle. We see each other every week now for a walk.
Mhm.
And, that kind of opportunity to track progress is amazing
Yeah.
because then, like, okay, so introduce me to who's in your life now
Mhm.
on the circle. And they might say, well, do you remember I used to have like all this conflict with Susie? Apparently, I only see clients who are friends with S names. But if I used to have all this conflict with Susie, but we kind of like sorted it out. We have like a really nice working relationship now. Um, and that kind of ability to track with clients, their growths, their strength is really wonderful.
Yeah. Yeah, I mean, it sounds empowering. Um, and speaking of like the hopeful part of it, you're in a shorter term therapy when you're not specifically meandering, you are able to hold on to what progress looks like and feels like a little bit more quickly, or it's a little bit more tangible.
Mhm.
Um, as opposed to, let's say, like a psychodynamic type of a therapy, which is great and wonderful. Like there is space for all therapies, but I think just for people knowing that this type of therapy is available and they can seek this out with a trained provider, it might even feel a little bit more doable to do therapy
Mm.
if you like know what you're stepping into, and you know you're not going to like don't have to spend the rest of your life doing it. Like you're going to go in for this piece of work and this period of time, and it's going to help for these things, and then you go on about your life and do it
Mhm.
over again someday if
And
you
you
want.
can always come back if there's something else that comes up. So, for clinicians, it's like IPT is easy to learn and hard to do well. That's kind of like the with a lot of therapies, I think.
Yeah.
But because you even said this at the beginning, it's tools I already use. It's like positive regard.
Hmm.
It is a lot of reflection. Um, it's collaborative. I mean, I feel like you're a very collaborative person,
Hmm.
so I just
Hmm.
make that that's how you work as a
Yeah.
clinician. And yes, those are all tools that you use before. But again, when like you're saying, if someone's coming in for like, I just like my partner's making me nuts, and that's what their goal is, or I'm really depressed, like I can't find my place postpartum, you get to kind of both see how can you support them in making change themselves,
Hmm.
uh, but your clinical skill of being able to teach them how to, and I say teach, but I really mean like collaborate, right? Collaborate with your client on how to have better opportunities. So, what am I trying to say? I'm just thinking about this in the context of, well, let me ask you, Kat, what's like a common complaint you might hear from a postpartum parent?
There's a lot of conflict in relationship. People not understanding them, like in relational conflict. It could be like parents and or partners, but just like I'm suffering. I don't know like what all is going on with me, and nobody else gets it either. So I feel alone.
Yeah. So, okay. And so I feel alone. So, again, in IPT, we're going to sort of say, here's what your diagnosis is. But just because it's a diagnosis, that doesn't mean you can't sort it out and work to change it. It's like if you
Hmm.
know that your diagnosis is, let's say, what, depression, anxiety, just for the sake of
Hmm.
our company,
Hmm. Hmm.
pick one,
Anxiety.
anxiety. Okay. So, if you know it's anxiety, and how does that anxiety show up for you? What does that look like?
Oh, oh gosh, there's a lot of feeling like I need to do everything. It's hard for me to let other people um, do stuff or take care of the baby or clean bottles.
Okay. So it sounds like a couple of ways in which it shows up is like you have difficulty asking other people for help. Mhm.
Yes. And I
And
wish they would just help.
you wish they would just help, right? And so right here in IPT, we might say, well, what does it look like for you when you're having an anxious episode and your partner is in the same room as you? And maybe in the beginning, he asked, can I do something? And you said, no, I got it. But now he doesn't even ask, and you can just feel the rage. Right?
Hmm.
But
Resentment. Yep.
so what does it look like though when so we kind of have a picture, and I gave a little bit more like pointed as just for this example. I might say to the client, like, well, tell me a little bit about what it looks like when you have that resentment.
Hmm.
How does that show up in with you and your partner?
I don't feel connected. I don't really want to talk much to them. Um, yeah, I feel like I'm by myself.
Okay. So it sounds like you're saying you shut down.
Mhm.
What does it look like when you shut down? How would I know if we're
Mhm.
sitting here together? How am I going to know if you're shut down? What does it actually look like on just in your body and in your face?
I'm usually pretty quiet, um, but I might be up doing a lot of stuff, just not talking to anybody or really communicating what I'm doing. But I just will keep very busy.
Mhm, mhm. Okay. So it looks like there's a lot of stuff happening, but you're not saying quite a bit.
Right.
So is there a way to kind of tell your partner, hey, when I am feeling anxious and then resentful, what it looks like is me doing a lot of stuff but not talking?
Mhm.
Would you be able to say that to your partner?
Yeah, I could say that, but then he's just going to tell me that I never let him help, so why bother?
That would be pretty frustrating. What do you think it would take for you to accept his help? Do you
Hmm.
want help now?
I do, but I don't want to have to ask for it all the time.
Mm. So this is like a tricky thing, right? Because you don't want to have to ask for it, but again, like he's got a barrier now that we've got to work on, which is, how do we get him to check in with you anyway?
Mhm.
But he said, in my experience, like I ask you if you want help and you just say no.
Mhm.
But now you're saying I do want help, but you also kind of want him to know that you want help.
Mhm.
If I want you to know something about me, how do I convey that?
You have to tell me.
Mhm. Yeah. So I hear where you get stuck. It sounds like you get stuck in wanting to um, ask for help, but you don't want to ask for help. But how can he know? If he was a mind reader, I feel like all of us would be. Um, I feel like you probably
I
wouldn't
just
be
don't want to
saying
feel
like,
disappointed.
"Oh, you don't want to feel disappointed." Yeah. What does that mean though?
Like if I ask for help and he doesn't do it or can't do it or won't do it, then I'm still have to do it.
Mhm.
And
So, how would you tell him that that's the barrier? Because it seems like what's really great here that I'm hearing is like one of your strengths is that you're really aware of what you're doing,
Mhm.
and that is a strength, right? Because that makes our work together so much easier. Um, and if you were to really be able to like say to him, I have an understanding of what my barrier is. Like my barrier to asking you for help is because I'm afraid you're not going to do it. How might he respond?
Well, I don't know. We haven't talked about it to that point yet.
Okay. Well, gives us a chance to experiment, right? Because
Mhm.
you get the opportunity to let him know
Mhm.
this is what's happening. You give him a chance to know what the barrier for you asking is. And
Mhm.
then you can come back here and next week and we'll sort of say, okay, you experimented, you told him, and then he was hopefully open. But if he's closed, maybe that means that we have to fine tune how we're asking for help.
Mhm.
But that's something we can do together. Like you don't have to do it alone. We'll sort it out.
Cool.
So I really appreciate you playing along with me.
Yeah, yeah, yeah. I had a couple of different people swirling around in my head for that. So I
Yeah.
recent conversations this week.
Yeah.
So that was helpful.
I think so. Part of it is, really continuing to pull out the strengths. And
Mhm.
when you're
Mhm.
doing IPT and you're focusing on your goals, you're also focusing on what the client's strengths are,
Mhm.
right? And so, if we had done like a more extensive, intake process, I would know that one of your strengths are, insight into your own behavior.
Mhm.
And it's things like that that we get to build on with communication.
Right. Right. And people might not recognize that they have a particular strength. And like even acknowledging it, let's say in the moment, can be part of that empowerment.
Mhm. Yeah, and again, we're really building on what the affect is.
Hmm.
And so, for example, I've had clients give me feedback of like, well, you said that like kind of surly. Or, because I have a certain cadence in my voice and I have to be like, you know what, you're really right. That's something I have to notice about myself. Like if I'm getting agitated and when I'm role playing or whatever, I have to really acknowledge that that's not going to get me what I want.
Hmm. That's nice.
Yeah.
And so like that's them giving you feedback.
Sure.
Yeah, yeah,
Right.
right.
And part of that's why it's so collaborative, and I think much more decolonized from other therapies, right? And in psychodynamic, maybe you would call that having a process discussion,
Hmm.
right? And of course, as therapists, we want to always be perfect in how we're conveying things to clients, but we're unfortunately, well, thank goodness, we're not AI yet, right? We're not yet.
Yeah.
Uh, So, if a client says, well, I really don't like how you said that to me, I say, okay, well, help me understand what it was. Well, you purse your lips when you say that. Well, that's not something that I was aware of. I really appreciate you giving me that feedback. And I'm really going to make a note of that. And so then the next time, I'm going to do my best to not do that or furrow my brow or,
Mhm.
you know, I kind of do this thing where I like look up. They're like, "Well, what are you thinking?" I'm like, "Oh, I can certainly understand when
Mm.
I look up like that. That's me thinking."
Mhm. Mhm.
And we forget how often our unconscious, all of our sort of affect shows,
Right.
right?
Yeah. Yep.
And
Yep.
so, if we're going back to your example, and she says, "Hey, I could really use your help with this." And he says, well, every time I ask you for help, you just don't let me do it. You know, the more adaptive ways to say, I'm really sorry that's happened before. I am asking for help now. It's not
Mhm.
easy for me to ask for help because I think I get disappointed that and afraid that you're not going to help me. And
Mhm.
that disappointment's really hard.
Mhm.
And I think in most relationships, someone's not going to respond with like, "Well, good, I want to disappoint you." You know,
Right. Right. Right.
most of the time, it's going to be a revelation of like, "Oh, I have a better understanding of how your anxiety is showing up right now."
Mhm. Mhm.
And so maybe we can make an agreement, she might say, that when I ask for help, I'm going to do my best to um, ask it in a way that doesn't feel hostile.
Mhm.
It's like, well, it's not your tone. It's that you look at me like I'm, you know, a fly or
Mm.
whatever.
Mhm.
Right. So that it's like, I think you're figuring out, sorting out ways to understand that it's tone, it's affect, it's the words, and it's being direct. Like people are not mind readers. And of course, again, we know all this, but when we're so confounded and tired and overwhelmed as new
Right.
parents, it's
Yeah.
incredibly hard. And this can take a lot of effort.
Mhm. Right. Um, yeah, which is, I mean, another reason why IPT is so useful and it being a shorter term therapy because you're in a transitional space phase time. I'm thinking of like early postpartum in particular.
Mhm.
Um, it's easy for stuff to go downhill pretty quickly if there you're you know but if you can get the outside support of a therapy like IPT, it can prevent that like long-term resentment or the feeling disconnected from your partner.
I hope so, right? I mean,
Right. That's the goal.
we get blinders on when we have depression or even anxiety, right?
Yeah.
It's like we're looking through our depression glasses or our anxiety glasses or, whatever other kinds of mood stuff is coming up. It's like really hard to see, and then we get caught in a loop. And I think the value of IPT is, again, we've been focusing a lot today on the communication analysis, but it's also as a reminder of like people are always astonished of like, I feel like I have no one. I mean, this happened one time. I
Mhm.
had a client who was like, yeah, I don't really have a lot of friends. And I was like, okay, well, let's go through this inventory. I get to know who's in your world. And so they wrote it out and they brought it in. And like, let me tell you, I was shocked by how many people were on the system. And then there's other people who were like, I have so many friends. And then, but they had a lot of people that they would only tell like more their core things to. So maybe on that concentric circle, they did have all people, but they were much farther away.
Mm.
They would had like four people. They're like, well, there's a lot of other people out here, but there's really only like four people I would put in these circles. So
Right.
it's both information for them, but also for ourselves. Because I said, it's so interesting. You said you didn't have a lot of people in your life, and what I'm noticing is that there are. And like, yeah, but this person and that person. I'm like, okay, but this is someone who's still in your life, and that is potentially a source of support.
Mhm.
Yeah, depending on what it is you're needing.
Right. Right. So well, I guess there are therapists listening and there are people who are interested in this type of therapy listening as well. But so first, where could a therapist go to learn more and get additional training?
Sure. In the US, the IPT Institute would probably be the best bet. That's who I'm certified through, and it's iptinstitute.com.
Mhm.
And they actually also have a directory, right? So there are clinicians and certified therapists. So if this sounds intriguing to you, as a client, of course you can go on that directory and maybe find someone local. And then for clinicians, one of the cool things is that there are always both online courses. But again, you know how we started by talking about, clinicians learn best when there are more consultations available, so that you're not
Yeah.
sort of like a silo. And there's really like a lot of online consultation opportunities through the IPT Institute. Unless you need CEs, a lot of times there's free options too.
Oh, good.
So I think that can be helpful if you've already done some of the courses to have access to that. And they're usually in the week. And then there's also, I just realized I don't know when this is going to come out, but there's a perinatal IPT course that is at the mid end of March online.
Oh,
So
cool.
that may be something. And then also one in Chicago. But IPT, all those consultations, because it's worldwide, there tends to be a really interesting community of clinicians from all over the country. I've
Mm.
had consultations with clinicians working in Africa, in Singapore, in Australia, and it's just really interesting to see how different countries and different cultural components
Cool.
are kind of using the modality.
So cool.
That is something that you're interested in that's available.
That's awesome. Yeah, thanks. I mean, even our conversation today reminds me of I haven't had a ton of training, but the little bit of training I have had is still useful. Even the level A training, like
Yes.
that stuff I am going to like bring back into my rotation next week because I totally it just like, you like get into your habits and patterns or whatever. And like, wait a minute, I have all these tools that I'm not even using. So, thank you.
You're welcome. I'm so grateful. I'm obviously passionate about it
Yeah. Yeah.
because I find it so. Again, I love to talk, so it's a nice opportunity to do that and to talk about something that I have passion about.
That's awesome. Thank you so much for bringing this up and giving such a vivid explanation of what it is, so that people can really know more about it and seek it out if they're interested.
Thank you.
To find out more from Elise, go to elisespringer.com, and you can also find her on Instagram at espringermft. And as usual, if you haven't yet subscribed to the Mom and Mind podcast, please do, so that you can get all of these episodes downloaded directly to you as soon as they come out. Every Monday and every other Thursday are new episodes. You can also find out when episodes are coming up by following me on Instagram and TikTok at Mom and Mind. Thank you so much for being with me. Until next time.